Hello everyone, this is Dr. Jawad. I did a video on obsessive compulsive disorder. What is it, the brain mechanism, and the treatment. And after editing that video, I realized I could actually splice that down to 3 smaller videos, which that I'm doing. So part 1 will be, what is it? Part 2, the brain activity, and part 3 is actually the treatment protocol. So this is part 1, and I'll attach on part 2 and 3 in the links below. Thanks for watching, and always, thank you for subscribing. Be good. Okay, so when it comes to OCD, now again, we all have bits and pieces of obsessive compulsive disorder. We all think about stuff. When I leave the house, oh my God, did I leave that on? Did I leave the stove on? Let me go back. Let me see, is my refrigerator running? Oh my God, it is. Where is it going? It's an old joke. But when it comes to OCD, is it taking over your life? Now, when it comes to obsessive compulsive disorder, basically it's a combination of obsessions, which are unwanted thoughts, meaning recurrent, intrusive thoughts, unwanted. Now, compulsions, obsessive compulsion, this is the actions. This is the actions to reduce anxiety from the obsession. So when it comes down to, for example, like afraid of germs, okay, the germs are the obsession. So the compulsion is constantly washing your hands. So they're always clean, they're always clean, and they're always clean. So that's where, but also it could take over your life where you're always washing your hands, you're always checking the door, you're always doing this, you're always blowing out the candle. So when it comes to OCD, yes, we do have obsessions, yes, we do have compulsions, but does it take over your life? The diagnosis is anxiety. It's an anxiety disorder that's characterized by unwanted fears, obsessions, and beliefs that drive the compulsive behavior. Remember, we're all wondering once we leave, did we leave the sink on? Did we leave the curling iron on? Did we leave, the light on? We all worry about that. Okay, now the five most common OCD, obsessive compulsive disorder actions are 1, organization. Now again, remember, we all have these, but does it take over our life? Organization, things are in the right place. This is kind of me. I kind of have this because I always like to know that the remote control is over there. In my office, I want to know where everything is in its place so I don't have to worry about, okay, where is this? Where's the reflex hammer? Where's this? And so forth and so on. Contamination. These are, again, wash your hands. It's always dirty. You're washing and cleaning your hands frequently. Intrusive thoughts. Intrusive thoughts, these are the unwanted thoughts. Now again, we all have these type of thoughts, but we do have a mechanism in our brain that kind of says, okay, let's back off a little bit. Ruminations. Ruminations, these are the dark thoughts. These are the thoughts that you're constantly thinking the same thoughts, sad or dark. And this is, I have a couple patients of mine, these are the ones who believe that they're never going to get better. They're always in pain. I'm never going to get better. I guess this is my life. No, it's not. No, it's not. And sometimes it's all in your head. But with the OCD, with the obsessive compulsive, they get trapped up in this loop. Checking. These are ones, again, checking about causing damage or harm, being careless. This is a person who's always checking doors, making sure the light's on, the light's off, the light's off, light's on. If you've ever seen the movie As Good as It Gets with Jack Nicholson, great movie. It really ties into a lot of what the OCD behaviors, really how it kind of takes over your life. Great movie, good actors. Okay, so let's talk about the cause. Now we have a lot of neurotransmitters in our body that either excites it or it calms it down. Now the cause is you have an imbalance of these neurotransmitters, 2 in particular called 1, serotonin, which calms you down, and vasopressin or antidiuretic hormone, which again too, it lowers your blood pressure. Could be multiple causes. 1, genetics, okay, it just could be in you. Also 2, brain, I'll get to this in a second. We have what's called the basal ganglion thalamus, and it works with the brainstem, and there's a loop that will either excite you, and also too, it modulates it to calm you down. And I'll get to that in a minute. History of trauma. Do you have a history of trauma? PTSD, divorce, abuse, neglect, family death. A lot of this childhood trauma, a lot of this, they say in theory, is a coping mechanism. It's a coping mechanism due to fear-based. PTSD, childhood trauma, childhood neglect. You're always checking things as a coping mechanism when it comes to OCD. Hello everyone, this is Dr. Jawad. Hey, over the last couple of years, my YouTube channel has grown tremendously, and I can only appreciate it, the viewers who subscribe. Now, if you're watching this on YouTube, please hit the subscribe button to get the first up-to-date videos, or you could always Google my name, Dr. Jawad, and you could go to my JDoc Real Minute page. Again, if you hit the subscribe button, you'll get the most up-to-date videos. And thanks everybody who's watching. I greatly appreciate it. Thank you.